Are you ready? Good afternoon and welcome to the McKenna Show. All this weekend we've been discussing various mental disorders. Today our guest is Dr. R, who will inform us about obsessive compulsive disorder. Well, thank you, Dr. R, for coming to our show.
Thank you for having me.
Dr. R, what is obsessive compulsive disorder?
Obsessive compulsive disorder, often referred to as OCD, is an anxiety disorder that triggers compulsive acts such as hoarding, cleaning, and obsessive thoughts. This disorder is often chronic and is potentially a disabling condition depending on the severity of the disorder and the patient.
Interesting. What are some symptoms of OCD?
Patients with OCD feel anxiety that stems from their obsessions and compulsions. The only way they're able to get relief is to perform their obsessive and often ritualistic acts.
I see. Now, what causes this disorder?
The exact cause of obsessive compulsive disorder is unknown. However, the culprit is believed to most likely be genetics. More specifically, the lack of neurochemical serotonin in the brain is said to be a causing factor of OCD.
How does this diagnosis come into play? What are some testing procedures performed on the patients?
According to the Diagnostic and Statistical Manual of Mental Disorders, to be diagnosed with OCD, a patient must have obsessions and/or compulsions. There are several tools used for diagnosis and screening of OCD. One tool is a screening quiz that will inform a patient of what level of OCD they have. Also, among the most trusted scales is the Yale-Brown Obsessive Compulsive Scale, commonly referred to as the YBOCS. These tools help clinicians to properly diagnose their patient and indicate what path of treatment is necessary.
Now, who is at risk for this developing disorder? Is there anything people can do to prevent this development?
Everyone is at risk for developing OCD. Oftentimes, a patient with a family history of OCD is more likely to develop it as well. Oftentimes, stress will cause the disorder in a patient. About 1/3 to 1/2 of all adult cases of OCD begin in a patient's childhood.
You mentioned to me before the show that there are different levels and classifications of this disorder. Can you explain to our guests?
There are 3 levels of OCD. Among them is mild functional impairment. This only occupies the mind for less than 1 hour. The next level is moderate functional impairment. In this level, OCD occupies the mind for about 1 to 3 hours of their day. The third level of obsessive compulsive disorder is severe functional impairment. Patients with this classification of the disorder are occupied by their obsessive and compulsory thoughts 3 or more hours of the day.
Can you tell us about some methods that could be treated?
After a patient is diagnosed, certain steps can be taken to treat OCD depending on the severity. If the case of OCD is mild, a short course of therapy will be issued. For moderate cases, they will have a more intense course of therapy along with the aid of medication. Children diagnosed with OCD are evaluated by a specialist.
Thank you for your insight on this disorder.
You're very welcome. Did you happen to notice the way I've been arranging these pencils throughout? OCD can be as mild as that or much more severe. It all depends on the patient and their specific case.
Wow, very interesting indeed. Thank you, Dr. R, for coming on the show.
Thank you.